Hello, class. Today I'm going to be talking about deep vein thrombosis. When we talk about deep veins are uh, more deep than superficial veins, which are close to the surface. So you can have deep veins in your legs and arms and pretty much anywhere else in your body. But when we talk about deep vein thrombosis, it's thrombosis is a blood clot. So deep vein thrombosis meaning there is a blood clot in a deep vein. So we'll go to the introduction here. Um, Deep vein thrombosis is a blood clot that develops in your deep veins of your body. Common symptoms are swelling, pain, and redness. Um, DVT occurs. It can occur with certain medical conditions or risk factors. Um, a DVT is important because it can lead to a pulmonary embolism, which is considered PE, and these two are known as venous thromboembolisms or VTE. And a PE is life-threatening, and you can die from it. So DVT is important. It's important to be aware of it. Important to know the signs and symptoms and physiology involved because it can lead to a PE, which can be life-threatening. Uh, Etiology of DVT. I put down the risk factors here. We can go into them. Hereditary, so it can be genetic. There can be genetic factors. Um, Limited movements and for long periods of time. So if you're sick, you're in bed rest, or you're driving for long periods of time, like maybe driving across the country, or you're flying to another country for, I mean, let's say you're going to like Japan or like China, like those are 14-hour flights. You can easily get a DVT in like flying for long periods of time. Uh, Trauma or surgeries can weaken your veins in your body, and those can lead to that can lead to DVTs. Certain medications, birth control, can lead to DVTs. Um, Obesity, smoking, cancer, heart failure, inflammatory bowel disease, and age can lead to DVTs. Another important one would be hyperlipidemia. Hyperlipidemia is high cholesterol in your blood, and that can lead to atherosclerosis, which is plaque buildup in your veins. And if you have plaque buildup in your veins, it's a very good spot for a blood clot to develop. So if you have hyperlipidemia and you have high cholesterol, that can be a very important risk factor in DVT as well. Put a couple pictures here. I just Google searched different pictures of like smoking a cigarette, heart failure. The heart failure is the one in the top right. I did obesity. There's a couple of obese people eating down some food and eating fast food there. I Googled nervous woman on flights. The old people down at the bottom. Old age can lead to DVTs as well. So they look really happy, but they're a bigger risk to develop DVTs, unfortunately. Demographics of DVT, about 60,000 to 100,000 Americans die each year of DVT. I got all these statistics that you see here on the Center for Disease Control. There's a lot of statistical data on America um, on DVT. So if you want to go look some statistics on about DVTs and PEs, you can go on their website. There's a lot of good information. But 900,000 people in the United States could be affected each year. So I mean that's a lot of people, and a lot of people aren't aware of the signs and symptoms. So let's say like you have leg pain. Like you could have leg pain and not really know what a DVT is, and you could be walking around with a DVT. Um, so it's kind of scary. On a global view of DVT or how we are compared to other countries, there's not a lot of statistical data. Most of the statistical data from DVTs comes from high income regions. I got that information from the American Heart Association, Center for Disease Control, and Mayo Clinic website. So all three of those websites said that most of the statistical data for DVTs comes from the more high income regions. There was an article that I read that said that they just didn't have enough money. Those countries didn't have enough money to study DVTs in those like low income areas, which I thought was kind of sad. So all three of those associations also said that many people are affected by DVT, but awareness remains really low. Um, you go into anatomy of DVT here. So on the left picture, you see the deep veins of the leg. So you see that femoral vein and the tibial veins and the small venous veins. Um, the majority of DVTs occurs in the calf region, and you'll feel the pain. You'll feel the symptoms in the upper region of the leg. So if you look on the right is two pictures of veins. One is a normal blood flow in the vein, and the other picture of the vein is deep vein thrombosis. So that is a deep vein with a blood clot in it. That blood clot is restricting blood flow back to the heart. This is a really good illustration of pulmonary embolism. So that picture of the vein there, you see the deep vein thrombosis, and if any part of that blood clot gets dislodged, it becomes an embolus. That embolus can travel back towards your heart and then through the right atria, through the right ventricle, into the pulmonary arteries, and then you have a pulmonary embolism. And then that can be a life-threatening condition. A lot of people die from pulmonary embolisms, so that is a very serious condition. So it's important to know like the physiology and how the DVT can develop and get dislodged and travel back to your heart and into your lungs. So that's why it's so important to talk about PE as well as DVT. Physiology and symptoms of DVT. There's a good illustration here from the World Thrombosis Day website. Pain or tenderness in the calf or thigh, redness, discoloration, and warmth, or swelling in the leg, foot, and ankle. All three and the signs and symptoms will tell you that you have a deep vein thrombosis more than likely. Signs of pulmonary embolism, labored breathing, high heart rate, chest pain, cough, sometimes coughing of blood, and syncope, or pretty much passing out due to low blood pressure. Diagnosis of a DVT. So I'm going to pretend to be the patient. Let's say I just got back from a world traveling. I was sitting for a long period of time, and get back home and my leg hurts really bad. I'm having the pain in my thigh, the redness and the swelling, and I think I might have a DVT. So I'm going to call my doctor or go into the emergency room or just health clinic nearby. And the doctor, if I'm going to go through a medical assessment, and I'm going to go through like medical history. And if the doctor thinks I might have a DVT, he's going to order me an ultrasound. There's two really good pictures of two ultrasounds right here. Let's say like right where it hurts, he's going to put the ultrasound machine. And on the left picture there is it's a picture of no compression. So he's not putting any compression on the vein that is where the suspected blood clot is. But if he puts compression down, on the right picture is that green arrow there is pointing at the blood clot or the deep vein thrombosis. And if that wasn't there, then the vein where it says V would be a lot more compressed. So usually with ultrasound compression, you can compress the veins and make them really small. But with that compression there, you can see that blood clot is still there. So I thought that was a really good illustration of that. Treatment of DVT. If you were diagnosed with a DVT, they're going to prescribe you with anticoagulation medications such as low molecular weight heparin. It's an anticoagulant or blood thinner. It's this medication helps treat and prevent blood clots. A patient who has had DVT has had a DVT may need to take this anticoagulation medication for months or up to years, depending on their overall health factors. So it's important to stay healthy if you have a DVT, and it's important to stay healthy to prevent DVTs from happening. Um, that last sentence there, these medications and maintaining a healthy lifestyle are key to for a strong recovery from deep vein thrombosis. So you can recover from it, but it's once you have that DVT, you're going to need to be taking those medications. But if you maintain a healthy lifestyle, you can overcome it. That's my presentation on deep vein thrombosis, and these are my references. I used Center for Disease Control, American Heart Association journals, and our Human Anatomy 5th edition book by McKinley. Thank you.